All right, so welcome to our weekly Child Care Resource and Referral and Community Partners meeting. We have a very lengthy agenda today, but I do think I want to pause for just a minute to let Joan queue up what's going to happen here in a little while before we jump into some of our other agenda items. And Joan, I'll kick it over to you.
Good morning, everyone. Great to see everybody again. We have an opportunity today to have Alyssa Chatterjee from the governor's office and possibly Miriam Calderon joining us to engage in a conversation regarding a couple of different things associated with the state's response to the COVID-19 pandemic. One of those is around the framework that the state will be using to guide its reopening, and Alyssa will be walking us through that. And then related to that is going to be a bit of a framework associated with public health and how public health will be applied to that framework. And then I know Alyssa has some questions. So I want to clarify that the slides that got sent out by John included questions to, I think really you should think about them as priming sort of the pump for the kind of questions that Alyssa is going to be asking. And be aware also that these kind of engagements are going on across many, many sectors in Oregon. For example, I know that the Children's Institute is hosting a conversation that some of you may have been invited to, and I understand, for example, that we'll be doing some kind of survey of childcare providers as a body. So you all are getting an opportunity to also be a part of this stakeholder engagement, and I'm sure that Alyssa can answer any additional questions that you have when she actually arrives to spend this time with us.
Exciting. This is going to be a great meeting, and I am really glad that we have as many people as we do have on this particular call. What we will do is, as we're going along here, we have several agenda items, as we always do, of things that are happening that we have updates since the last time that we talked, and we'll just kind of adjust as necessary. As soon as Alyssa and Miriam are available, we'll kick into their time and then pick up where we left off afterwards. And so I think there's a few things that we can jump through really quickly here and then get into some meatier conversations as we go along. The supplies, there's a slide update with that, and I would let Lisa or Denise, if she's on, bring us up to speed on those.
Good morning, everybody. This is Lisa. So good to see you guys. Thank you so much for joining us today. So as regard the emergency supplies, I just wanted to let you know that the team that's up at the warehouse in Wilsonville is processing about 170 orders a day. So we're really getting caught up on the orders that are coming in, which is really great news. Just to let you know about a few items that have become available. We have formula now, hand sanitizer, and hand soap. Which were really some of those highly requested and needed items by programs. So those have been added to the form. So when people go on there and order, those are now available. We are expecting baby wipes along with additional gloves by the end of the month. So that's kind of where we are with things. And as you can tell, just because the whole nation is trying to order these, it's really taken much longer than we would have anticipated. I did want to let you know we're working on a plan that if we can get it off the ground, it would be bleach drop shipped to county sheriff's office and emergency management centers, And then we are looking at having the option of either pickup or delivery by the local sheriff's office, which is kind of exciting and something to look forward to around what we're going to work out with that. So as soon as we will have more information on that, we'll be communicating with you, hopefully later this week, once it's all confirmed.
And I just wanted to also highlight within that there was quite a bit of logistics around shipping hazardous products like bleach. And so one of the ways that we could get it on the ground was really to partner with somebody locally, and the sheriff's offices were the ones that really made the most sense. And so I think there's a lot of opportunity there if this comes to fruition for us to highlight some really nice stories about how everybody in communities are coming together to get needed supplies to children, families, and childcare providers. So more to come on that, as Lisa said. CPR and first aid, just a quick update related to that. And we had talked a bit on our last call around being able to get some answers from Medic First Aid, because that's primarily one of the entities that you guys partner with most in delivering your CPR first aid in your communities. At least many of you do. And since that period of time, and I don't know, are you on the phone, Ronnie? Just want to check before I go too deep into this.
Yes, but go deep, John.
Okay,
go.
so I'll start and you correct everything I say. So the interesting part that has occurred is that American Heart Association issued their protocol and ensuring that they're allowing any certifications that are expiring to be extended for 120 days. So that begins in March. So any that were expiring in March, and if providers have an American Heart Association certification, they'll have a 120-day extension. And our regional managers for licensing have made the determination that they will accept those extensions during this period of time. But if we are sort of back online and going again, we wouldn't necessarily need the 120 days in full. So if we're put back into some form of regular business with childcare, then it would go to that 60-day requirement. Am I right on that, Ronnie?
Right, John. Right, John. It's actually the 60 days after the state of emergency is lifted, or the 120 days, whichever comes first.
Thank you. Much clearer. And for Medic First Aid, so I think what's important around the American Heart Association is that you guys may not be partnering with them, but you may have providers that are expiring and not necessarily aware that they have this leeway, and so you can help advise them that they may not need to be taking any recertification at this point. They do have some period of time to wait and see what's going on. They don't necessarily need to be doing this online format. That gets pretty confusing, so I think delaying would be the best case scenario. And then with the Medic First Aid, that one is we're going to wait a little bit before
I'll let myself know.
I hear some folks that might need to be on mute. If you can go ahead and mute your phones, that would be great. With Medic First Aid, they have a recommendation to extend for 120 days, but they are putting a little bit of ownership on the regulators or employers that have their own policies. And so in our situation, we are sort of the regulators and have a policy where the liability in some respect may fall on us. So our leadership is looking into this a little bit more closely before we accept this sort of 120-day recommendation with medic first aid. So we will have more information to come in probably the next week around how we're handling medic first aid's recommendation. It's just a little bit different than how American Heart Association decided to handle it. And so we'll take a look into it a little deeper, and we'll probably have some more information for you guys between now and the next week. So any questions coming up about that?
John, this is Taya. I'd just like to make a comment that it would be super awesome if we can make that work with Medic First Aid, because they don't have a Spanish option. And so we found a backup way to handle that, but it's a lot more expensive. So just putting a plug in there that would help things go more smoothly for our Spanish speaking providers, for whatever that's worth.
I appreciate that, Taya. Any other thoughts to add on any of that, Ronnie? I see there are a couple of questions also.
You know, John, I want to speak to Jerry's question about the renewal or the first time folks. You know, in our licensing rules, we don't speak in the rules about whether it's a refresher or a first time course, you know, whether that person had the full 8 hours or the full 4 hours. The licensing rule says current first aid CPR. So we don't really get into those issues of renewals, refreshers, first time folks, whatever those terms are, as far as the licensing rules go. Because I had that question earlier, so I just wanted to address that. I think that's it in the chat, John. You're done with me.
Excellent. So more to come with Medic First Aid, and I think it's good that those organizations are thinking about what it means to social distance in terms of getting these recertifications. So we'll keep you up to date when we know more. Lead, Learn, Excel. I just wanted to make sure everybody saw that email coming from Andy. Andy, I don't know if you want to chime in at all related to this, but we did get Lead, Learn, Excel bumped out until just after the preschool promise applications are due, and so it will occur on May 5th and 6th in the same format that we were going to do it previously. So Andy, are you on?
I'm here. I am. Morning all. I'm sorry, I can't turn on my camera. It makes my computer freeze. But yeah, so May 5th and 6th, everybody should have gotten the invitation to that. Folks will need to register for each of the different sessions. So there's the 2 sessions on the 5th, the morning 2-hour session and the afternoon 2-hour session. So those are 2 registrations there, and then the registration for the 2-hour session on May 6th. And so those invitations went out yesterday. So if you know of a staff member who should have received one who didn't, please let me know. And the pre-work is and the links to everything is all listed in there. And again, a lot of it is just reviewing some of the materials before and knowing how to pull them up and have them ready during the training. So if there's any questions about that, please feel free to reach out to me at any time.
Excellent. Thanks, Andy. Let's see. I was just looking back in the chat box. Did your question get answered around supply orders for emergency childcare programs?
No, and it's kind of a silly clarification, but I've got somebody that has got their emergency childcare approval, but they're not caring for children yet, and they need some supplies to be up and running, and I wasn't sure if they could place an order yet or not.
I mean, I think they can place an order, but they'll probably get sidelined until they're official. Is that what you think, Lisa?
Yeah, because the form does ask them how many children they have in care. So it will get kind of pulled to the side, probably for clarification. They're definitely willing to fill it out if they want to, but it might be best to wait until they at least have one child.
If the clarification is that they need the items in order to take children, is that acceptable? Trying to get them open, but they need supplies to open.
So I think we can, if you want to just send us the name of the program, we can look into a little bit more on our end. Just email Lisa and I, and we'll.
Okay, perfect. Thank you.
Sure. All right. So in this next section here, I think what we'd like to do, if Joan is available, we'd like to start off with a little bit more information about where we're at with our funding that's coming into Oregon from the CARES Act, and a few other items that we have in this area.
Hi, John. So I can talk a little bit about the CARES Act funding. So we are still in the process of the state basically receiving and making a determination about how to proceed with the with using these different funding streams that came as a part of the CARES Act. And I think I've mentioned a couple times, I think there were 42 funding streams, of which the CCDF portion is just one. I think from the resolution and the information we've shared, we've essentially kind of initially were really thinking around 4 kind of buckets of ways to support. I would say that the pieces that the Early Learning Division and the Oregon Department of Education are really working very diligently on are associated with the wage supplements, which is that first piece that you've seen and we've talked about before. So wage supplements, and then also the program stabilization funds, funds to help offset the cost of the reduced group size. That last sort of bucket of things that was around supporting programs that are closed, I think that has really been recast at this point as thinking about what kind of supports are going to need to be made available for programs to reopen. So a lot of details are being worked out associated with that, but I don't anticipate that that's going to be something that's going to happen right away. Whereas those first 2 are the ones we're working and think we're the closest to being able to launch. And as soon as we have official launch type information of any kind, of course, we'll be talking with you about that. And we know that you will get questions. And I'm being purposefully vague because, of course, a lot of these details really still have to be worked out at every level. And then I think that third bucket of resources is something that we're really exploring how we can, you'll remember that was really focused on trying to make sure that families who were experiencing hardships, who weren't eligible for ERDC, might have access to resources to help offset the cost of care. So these might be folks, would be folks who are essentially essential personnel, first responders, et cetera, but they make too much money to qualify for ERDC, even with the expanded guidelines, but they're still not in a financial situation where it's not a strain for them to be paying for childcare while they're working. And so we're exploring some ways in which we might be able to get those resources more directly to families, not trying to filter them through childcare, but making those resources available more directly to families. So none of these things are certain yet, so please don't promote them as though they are. I'm providing this information to you so you have a sense of where things are headed. And then, as I said, when we are able to talk more about specifics, we will certainly talk about those specifics with you. But I want to be clear that we're continuing to think about how do we support the folks who are still working in childcare? How are we helping to support programs who are experiencing financial hardship because of reduced group size? How are we helping families who need care but are struggling to afford it? And how will we help businesses reopen? So those are all of the things that we are really still have on the table and are exploring how we can really be able to make those resources available as quickly as possible.
And Joan, I know that you were being intentionally vague, and I am going to ask you a question that you can then vaguely skirt around if you don't think it's necessary. But I was wondering if it would be good for folks to know that there is a little bit of a process for how we seek approval to utilize these funds too. I think it was insightful for me to know that it isn't just CARES money hits Oregon and we start using it.
Right. So there's a process in place where agencies who have funding streams associated with the Act put together their proposals. Those are submitted, and then those are reviewed by the governor's office, I think the legislative fiscal office, and others, because of course the state wants to make thoughtful and feasible, useful investments, and wants to be looking at the totality, not 42 different funding streams being decided over by lots of different people, maybe resulting in gaps or duplications from very well-intended people. So this process that's been put into place is intended to help make sure that there's a coordination and a broad look. So that has just added a couple more steps to what we were anticipating, but it's not any kind of barrier, and it's overall, I think it's very helpful to have coordination of these funds, because of course we know that families and child care providers are impacted potentially by these other funding streams as well. I think that's what you wanted me to say, John.
Yeah, sorry. I think that does fit in. I know that as our CCRNRs are out in communities working very closely with child care providers, I know there are child care providers who are pretty aware that funds have been allocated to states. And I think it's important in our messaging, from you guys to them, that they realize there is a process, even though we know there's money coming, and we've been, informed that even sort of the amounts that we may receive, it's not just ready to roll, and that we're just sitting on it, not implementing when we could be. There's a process, and it will get out as soon as it possibly can. And I think it's just important for providers to realize, like, this is coming, and it is going to be there to help them in various ways. And it's our intention to get it out as soon as we possibly can. But yeah, that's where I was headed with that. And I want to bounce around on our bullet points here real quick, because I know there were quite a few questions about ERDC at our last weekly meeting. And so I just was wondering if Jen, if you were available to come on the microphone here and talk about any updates that you guys might have from your side around ERDC payments, and specifically around May payments. I think people were hoping to hear updates if we have any.
Yes, and we've been having a lot of discussions about May payments. So I know we had sent out some talking points with anticipated changes to specifically to absent day policy and the coverage of childcare closures. And we're actually going to be pulling back that information. So at this point in time, we have no guidance that is different from what was given for March and April as far as the absent day and closure policy. So we do apologize. We were trying to keep you guys in the loop, but we looped you in a little too early. And then apart from that, some of the bigger changes that we have that are actually currently happening is that we had pushed all of the pre-service trainings to being after listing. So that included the intro to health and safety for both the family providers and the regulated subsidy, as well as the RCAN and CPR first aid. And actually the online trainings, so the ones that we previously had online, the intro to health and safety and RCAN, those are being moved back to pre-service because there hasn't actually been any issues that we've run across with people being able to access those. But the CPR first aid is still moved to after listing for regulated subsidy. And then it's following the same guidelines as Office of Child Care. So we're doing the online portion only. Once all of this is said and done and over with, we will communicate with those providers about getting the in-person certification, and that will be a requirement. But we'll have some buffer time built in, and we'll work with those providers to make sure that they have access and that they'll be able to get into those classes in time.
All right. Looks like Taya Harvey had a question about that.
Yeah, I do, because this actually is coming up. I just spoke with Nadia, who works with our Spanish-speaking providers, and so some of our Spanish-speaking providers don't. That population tends to maybe have less access to technology. So we have one right now who needs to take an online training, doesn't have a computer. Normally would come to our office, but our campus is closed. So are there computers available at DHS offices, or do you have any suggestions where we might send people for that?
In some local branch offices, there are computers available. I can't say for sure that they're available in all offices.
I think this is people,
if you know.
This is Regina. I think they are limiting use of those right now. So I don't think that they're available to providers in all of our offices right now, just for safety precautions.
Okay, and with any of those where they don't have internet access and we can't find access for a computer, I think this is definitely going to be something that we'll be facing probably more and more of in the future. But there are also some local resources that I know have been becoming available for some people. It's just difficult because they're not statewide, and we don't have any kind of comprehensive comprehensive list. And I don't know if I mean, Carrie, not to put you on the spot, but I don't know if 211 has any sort of resource list for things like that, like people who need internet access. I know there are some places that are popping up with hotspots where people can access internet when they go to like sit in a parking lot, but that varies by community as well.
I think what we have are just the free internet services that are offered, like through Comcast and things like that. But I don't know that right now. We have updates around all those kind of free spots where people can go to a parking lot.
Okay.
Yeah.
And it sounds like it's also an issue with computer access, so not just internet access. So that is something that we'll have to. Just as you guys come across cases like this where you have someone that doesn't have that access, we're just going to need you to reach out to us directly, and then we'll try and work through what kind of process we can do to try and make sure that they have the access they need to get those training requirements in place. We may be able to look at a case by case, like waiving the requirement until post listing, but we'll have to check on that.
All right, so
Okay.
got some things.
I guess that just applies maybe more to more than just DHS, you know, for example, like the first aid CPR recertification, even for licensed providers. So does the ELD have any direction on that? Would you still want us to do case by case and connect them with somebody? And if so, with who? And I'm just saying, because we have this immediate need, like we have somebody we need to get back to now. It probably will come up more, but we really are at a loss. We're looking around the community and can't find anything. So I guess my question is also to ELD, if you guys have any suggestions.
So I apologize, Taya. I'm not sure if I understood what the question is to us in relation to that.
Well, so it could apply to, Jen was talking about Intro to Health and Safety and ARCAN, so that could apply. Or if we have somebody who needs to renew their first aid CPR online, which I guess is licensing, but in any case, any required training, any of those trainings, and we have providers who have no access to a computer. So I could ask licensing too, if you think that's more appropriate.
Well, I think we have Tammy on the line here. Not sure if she's tracking the particular conversation. I would say, if we're talking about folks that are unable to complete things based on technology and other needs, they would definitely want to be chatting with their licensing specialists too, to just because there are processes for waivers and other things if those are appropriate. But Tammy, do you have anything you?
Yeah, we of course have say, well, go to your R&R, and I know that you're in the same boat that we are, where we don't have computers available either, so we totally understand. So I would say work with their licensor and see whether they need to go through an exception process right now to wait until things open up again.
Okay, thank you.
Well, and then are there any options for, I know this wouldn't work for CPR first aid, but a self-study packet type of thing for ARCAN, or, that may be something that we'd want to look into pursuing for the Intro to Health and Safety too. I know that's the kind of the route we went with the orientation to make sure it was available. But I really don't know with those trainings what's currently available or how easily it could be kind of transitioned over to a self-study packet where you wouldn't need internet or computer access.
This Pam, and their ARCAN does have a self-study packet. Those are done out of the local R&Rs. ICCHS does not have that at this point, but we could certainly pursue it if that's a need.
Okay. Well, it's good to hear about the ARCAN.
This is Shannon. If they're willing to travel, we're opening on a limited basis, and I have some computers or even an iPad. We could work something out.
Okay.
All right. Let's see. So is it possible? Did Alyssa join the meeting at this point?
Yes. Hi.
Hi,
She
Alyssa.
did.
So, folks, there's a lot of questions here in the chat box. We will come back to this if we have time, but I definitely think that we want to transition over to allowing Joan to do an intro for Alyssa, and we will pick up where we left off later.
So I think more than anything, Alyssa, do you want us to make you the presenter? Would it be easier for you to run your own slides?
Sure. Yeah, that's great.
Okay. Can you do that, John?
Yep.
All right.
Coming your way.
Awesome. And then I think, Alyssa, whenever you're ready, as of last night, I think Miriam was going to try to join at some point, but I know that there is just a lot going on right now, so I think we should go ahead now that you're here, as long as you're comfortable with that. Yep. Okay.
That's great. And can everyone see my screen?
Yes.
Okay. So
As most of you probably have heard, last week the governor started talking really broadly about a framework for reopening the state, and we've gotten some additional federal guidance on what that process can look like as well, on that as well. So we have been asked, there are 6 sectors that have been identified, and childcare is one of them, that we're thinking would likely reopen in phase 1. And so I wanted to quickly walk through kind of that framework. And we'll be sharing this with the Head Start Association tomorrow morning and with child care providers tomorrow afternoon. Family Forward will also be recording that and making it available. We are working on a survey as well to go out to child care providers. And the idea of this is that in addition to the broad framework for the state, we're working with public health on developing revised guidelines for childcare. And the goal of the stakeholder sessions this week is really going to be getting feedback from, in particular, childcare providers on how they could implement this new potential guideline from public health. And I wanted to take this opportunity to hear from you all, any concerns you see, monitoring and training support opportunities or barriers you see. And this will be an iterative process. So we have really ambitious timelines to have some draft guideline recommendations by this week. Those will definitely not be final, and we'll continue to engage partners such as yourselves in figuring out what actually will work. So I'm going to take a few minutes to run through the reopening process, and then a couple minutes to run through what public health has given us so far, and then wanted to get a couple minutes from you all to hear your feedback. So jumping right in, as you probably heard Dr. Fauci say, you don't make the timeline, the virus makes the timeline. So while I know a lot of people want hard dates, we just can't give those at this time. We'll be living with this virus until there is immunity, so this is many months away. That being said, we do think there is a way for childcare and some other businesses to potentially start reopening. So some of you may have seen this graphic, but as you know, our goal is to keep the curve flattened. So our experience in other countries and modeling says reducing social distancing too quickly will create a spike in cases. So as you'll see, the blue line indicates us really maintaining these aggressive social distancing interventions and business closures. So we're trying to manage reopening businesses without getting us into that orange section and really spiking on cases. So as I mentioned, we did get some guidance from the feds on opening up America again. We do have 2 panels that the governor has convened. So one is the medical advisory panel, and they're working with the health authority to really review this and understand the criteria. So that's going to consistently change. The other group that's been convened is the Governor's Council on Economic Advisory. And so they are also going to be a part of this kind of evaluation process to bring forward the economic perspective in balance with the public health perspective. These are the criteria of what needs to happen before we even get into these sort of phases of reopening the state. So there are 3 components to the gating criteria. These are the things that have to be met before we even talk about opening up childcare. So we have to see declining numbers in symptoms, declining numbers in cases, and we have to make sure we still have enough hospital capacity for both regular procedures and adequate testing for COVID-19. Once those gating criteria are met, we then need to look at our core state preparedness levels. Those components are robust testing and contact tracing, our healthcare system capacity beyond hospitals, and this includes PPE and surge capacity, and plans for health and safety. And as most of you probably know, we're pretty far off on the testing and contact tracing areas. We're working hard on PPE, but these are some pretty big components that'll be very difficult to meet before we can talk about reopening businesses. The last portion of this framework would be a phased lifting of restrictions in at least 3 phases. So as I mentioned, childcare right now is potentially in phase 1 of these lifted restrictions. And this would likely happen at a regional level. It could be countywide. We're working on kind of what that looks like. But we recognize that some portions of the state may reach these criteria and components before other parts of the state. So digging into this a little bit more, the gating criteria I mentioned. So the downward trajectory of symptoms is looking at influenza-like illnesses reported within a 14-day period, as well as the downward trajectory of COVID-like symptoms and cases reported within a 14-day period. On the case level, we want decline in documented cases within a 14-day period, as well as a downward trajectory, or a downward trajectory in the number of positive tests as a percent of total tests within a 14-day period. Lastly, looking at hospitals, we need to make sure that they can treat all patients without crisis care and have robust testing programs in place for at-risk healthcare workers, including emerging antibody testing. So again, there's a lot that needs to happen first. And as you'll note on this slide, we're likely going to be using modified metrics, especially for rural counties with small numbers. For the state preparedness portions 1 and 2, as I mentioned, looking at screening and testing for symptomatic individuals, testing for influenza-like illnesses, and ensuring sentinel surveillance sites are screening for asymptomatic cases, as well as contact tracing of all COVID plus cases. These are things that we just do not have in place at a robust level at this point, and will take a lot of investment in infrastructure to be able to get this rolled out across the state. We are working with our healthcare system to ensure that they have sufficient personal protective equipment. We're defining what sufficient means and working with them to make sure that they have what they need to begin reopening. We also need to make sure that there's an ability for surge ICU capacity if we do see another spike. So this last portion on planning. So we want to protect the health and safety of workers in these critical industries, protect the health and safety of living and working in high-risk facilities like senior care facilities, protecting employees and users of mass transit, advising citizens regarding protocols, social distancing and face coverings, and then monitoring conditions and being immediately able to take steps to limit and mitigate any rebounds or outbreaks by restarting a phase or returning to an earlier phase. So we're going to be doing this every 14-day evaluation. That if we're not seeing an increase in cases, we will move to the next phase and begin opening additional businesses. If we do start to see a spike, we will either return to the earlier phase, restart a phase, or roll back parts of the phase. And this again could be regional. It's going to depend on severity. So this is going to be a slow process, and it will likely shift a lot over the next couple of months. So phase 1, we're looking at the guidelines for individuals. This is what the health authority has put out for us. So practicing good hygiene, strongly consider the wide use of face coverings in public, and staying home if sick. For employers, developing and implementing appropriate policies, social distancing, protective equipment, temperature checks and sanitation, monitoring your workforce for indicative symptoms, and contact tracing policies for positives. And these are broad guidelines. This is obviously not tailored just to childcare, but this is the broad guidelines that the health authority has put out just for everybody to be considering. We would continue with all vulnerable individuals continuing to shelter in place. When in public, they should maximize physical distance, avoid socializing groups of more than 10 people, close common areas, minimize non-essential travel, and continue telework, which we again know does not apply to childcare. These are the specific types of employers that the federal government has proposed. You'll see on the right-hand column that we're modifying this slightly. So while they talk about schools and organized youth activities remaining closed, we are having a carve out in there for reopening childcare in phase 1. You'll see we're making adjustments on large venues, sports, theaters, churches, and on down through the list. But we are looking at having childcare included in this phase 1. For the geographical considerations, as I mentioned, we will be looking at those criteria: declining growth in symptoms or cases, regional testing capacity, regional hospital capacity, contact tracing, and the region's work with OHA on plans. So we're hoping that we can roll this out at a county by county level as we start to see those declining growth, and we start to see the capacity increase in being able to do testing and contact tracing. These are the other prerequisites for opening. So this is more about the health system, but just so you can get a quick glimpse: letter from the CEOs and CMOs of hospitals within each county committing to daily PPE reports, to the health authority so that we can ensure there's enough PPE, a recommendation from the county public health officer, and a vote of the county governing body certifying PPE for first responders is sufficient. So that would be part of this regional reopening process. For phases 2 and 3, this would be beyond childcare potentially. We would wait at least 14 days and move to the next phase. After phase 2 is completed, moving into phase 3. Again, we could end up walking back if we see spikes in cases. The walk back could be all businesses that were in phase 1. It could be select businesses. So these are the high-level presentations that are going out to folks right now. As you'll see, we're trying to talk to the Economic Advisory Council, communities of color, tribes, outdoor recreation sectors, health departments to get feedback on this. These are the 6 sectors I mentioned earlier that we've identified as potentially reopening in phase 1. So restaurants and food service, retail, personal services, including hair and nail salons, childcare, transit, and outdoor recreation. We're beginning presentations end of last week. Our goal is to have childcare guidance and others in this sort of first phase drafted by the end of the week, with complete details of the framework the week of May 4th and finalized step-by-step reopening plans in early May. This will all, of course, be done in coordination with the West Coast states per the pacts that the governors made earlier in the month. These are some resources, and I'm happy to send an email with those so folks can follow those links if you're interested. This is the last thing I just wanted to flag, and then we can pivot to the child care specific work. So these are the sort of immediate things that we're focusing on as a state. So looking at those gating criteria around symptoms and cases and sufficient PPE. So that's where we're focusing a lot of our energy right now to make sure that we can really start talking about reopening childcare and other businesses in phase 1. We're also looking at hospital capacity, testing, and contact tracing, and the guidelines for specific sectors. So that last portion on guidelines for specific sectors, as I mentioned, we're engaging the Medical Advisory Panel and the Coronavirus Economic Advisory Council for review. So they will be continuing to receive updates on what these draft guidelines end up being based on stakeholder engagement. The last component, I believe, is systems for hardest hit and vulnerable populations. So we're looking at specific guidelines for COVID positive nursing homes that are currently being stood up and working through a health process there. And I again can send this slide deck to you. So right now, the Opening Up America, again, vulnerable individuals definition includes the elderly, those with serious underlying health conditions, and those whose immune system is compromised. So those are the additional populations we'll be focusing on. And I know I'm running very quickly. I'm going to turn real quick to the child care specific health authority guidance you've gotten so far, and then want to pause for questions. So this is really recapping a lot of what I've shared, looking at the downward trends and capacity to quickly stop the spread of disease. The public health department and Oregon Health Authority are really working to recruit and train an additional estimated 600 staff, making sure there's expansion of technology capacity and equipment to really support these efforts. Again, we're looking at recommendations for individuals: stay home if you're sick, good hygiene, staying 6 feet away, using cloth coverings, staying close to home. Same guidance for employers: teleworking when possible, monitoring for symptoms. This is what they put forward for childcare so far, which I know is pretty vague, especially in comparison to what we have in place right now. So they do want to limit the number of children in facilities and in rooms. Would like to maintain cohorts of children by age group, and having cohorts of specific staff with groups of children and rooms to avoid crossover. So this is getting back to that stable group requirement that we currently have in place. They are, which I know this is slightly stronger language, they've said to consider having staff wear cloth face coverings. So these are the broad stroke recommendations we've gotten from the health authority. And our goal is to work with you all, childcare providers, and other partners to figure out how do we actually add detail to these and figure out what child care providers can implement, what they would need additional resources to be able to implement, and for you all in particular, kind of what concerns are you seeing as you think about training providers, providing technical assistance, and helping them kind of remain in compliance with this guidance. So with that, I will pause and take some questions from the group. I don't know, John or Joan, if you would like to go to the chat first, if there's been some questions coming in there.
Yeah, so currently there's no questions in the chat. We can open it up for questions from the group, though. Thanks for the quick overview of what's being planned and prepared. So it looks like Karen Hinkemeyer put a question in the chat box. Can you explain the cohort by age group? What does this look like in family child care?
Yeah, so those are the areas where we're really going to be looking for feedback from our child care providers on Wednesday. Is how could they implement this? Is that something that they could implement? Is that something that needs to look different for centers versus family child care providers?
And then Christine, you were asking, can we have multiple times for statewide webinars around this? Is that webinars for us to understand how we're delivering it, or for child care providers to listen in and understand? You might be on mute. Oh, no, you're not on mute. We just couldn't hear you. Now I hear you.
Okay. I was thinking for childcare providers. I just think it's a lot of information for us to try to put out there. And I think it might be helpful if we could do some sort of even recorded webinar that was speaking directly to childcare.
Yeah, so on Wednesday, Family Forward is helping convene child care providers. They're working with AFSCME and SEIU to get invitations out. And that will be a recorded webinar. It will just be for child care providers. They're planning on posting it on their website. We can make sure CCRRs and other partners receive it. I'll also make sure you all get a copy of the survey link once that's out. We are doing it in the 5 major languages being translated right now. And then, so you'll have that information as well. And then our plan is to be able to circle back to, at the very least, child care providers with continued discussion as we start to kind of work through this initial guidance and get feedback from public health.
All right.
Alyssa, this is Joan. I think I was also hearing maybe underneath that, what is your ask of R&Rs? You're not asking them to go out and share this information on your behalf. Can you clarify that, please?
Yes, absolutely. No, this is just sort of for your information, so you know what child care providers will be hearing. I also, to the question about how this would look in family child care settings, any questions you'd like to prompt or any concerns you see, which I know this is very vague guidance, but any concerns you see about being able to support child care providers in implementing some guidance. And once we start to get a better sense of the contours to this, get some details, I think it'd be great to reconvene this group to talk a little bit more about what this looks like in implementation when we've got more meat on the bones for that.
Thank you.
Toby, it looks like you had a comment about family child care providers with mixed age group. Was there anything additional to that you wanted to say, or was that just in reference to sort of being aware and making sure that we understand?
This is just in reference to be aware, because many providers, especially in our counties in Eastern and probably all across the state, they're mixed age groups. It's going to be difficult to stick to one age group, and it's going to be difficult because this is their livelihood, and they're already fussing about everything that's already occurred. So just trying to figure out how we can thoughtfully move forward and help them the best we can during the situation.
Yep, that's helpful. I will say too, this is changing every day. I've gotten this PowerPoint sent to me a couple times already just this week. So the health guidance is definitely malleable, and I think as we talk to providers, if the prevailing feedback is that we cannot really implement this single age group requirement, that might be something we go back to the health authority and say, this isn't doable. How do we meet in the middle on this? So it's not necessarily taking what the health authority has provided and just implementing it across the board if there's some significant barriers to operation. And that's what we're trying to understand. I think the other piece too that we're really going to try to message and would love your help with this is, as we reopen childcare and other businesses, it's not going to be business as usual. So I think trying to support providers as much as possible. We know that they're not operating with enough capacity to make their business viable, right? So we know that they need more financial support to operate this way. But I think trying to be able to socialize this idea that they're not going to be able to return to operating their child care program the way that they did pre-COVID-19. We don't know how long these changes will last, but it's going to be really gradual. It's very unlikely that, come June 1, everything's back to normal. So just trying to help providers understand that and make the best business decisions they can with that in mind.
I also just wanted to notice that Miriam Calderon has joined us. So everyone is aware of that. Thanks, Miriam. Good to see you. John, it looks like we had at least one other question in the chat.
Yeah, I see some comments. I'll invite folks to come off of mute if they wanted to say anything to those comments, but I see that Taya was asking, how long will emergency care remain in schools in relation to this process or timeline?
And I'm asking that, as you all know, that's obviously hugely, here in Lane County, like I said, the care is free, so it has a huge impact on people enrolling in childcare that they'd have to pay for. So I'm just wondering if that has been incorporated into the plan to roll back the ECC in the schools as we reintroduce it in licensed childcare.
Yes, so we've already told school districts that they're not expected to operate school-based emergency childcare past the end of their school year.
And so my follow-up question with that, if it's all right, is they're not required to, will they still have those guidelines in place for ECE or ECC and still have the option of providing it in the schools?
What we're hearing from superintendents is they cannot financially support these programs into the summer because they'd have to pay staff overtime essentially. So no schools we've heard from at least have said that they want to continue the program. And we're working on a process to make sure that ELD and you all with the CCRRs can help get those kids transitioned into licensed emergency childcare.
Okay, thank you.
And I think there were a couple of comments related to some of the, kind of crossover contamination and things around staffing when there may be separate age groups of only, 1 or 2 kids in that room. And it just, in previous times, there was an ability to combine groups, and do things a little differently and have staff go home early. So we're reducing costs, and I think there's going to be some considerations that we need to look into around all that as we move forward, and the viability of how these things go into practice.
I think that, John, just really quick, not even just going home early, but being able to assign staff to do the cleaning processes and things like that might come at the end of the day that would be helpful. And I just had that question because I had a small center that had multiple families. And so the logic in it was they're in these separate rooms. We didn't put families together, and now they're going home in the same car on the way home. It just makes it logically a little harder to process, I think.
Yep, that's helpful.
Yeah, thank you, Heather. So most of those were comments leading into this that we will keep in the forefront here, and also I think to Alyssa's comments that we will maybe reconvene around some of this as recommendations become a little bit more solidified. And I think the information that we're receiving from childcare providers will really help us as we're starting to open this up a little bit more flexibly. But any other questions? And I definitely would want to pause for a moment to let Miriam join in if she's has anything that she'd like to say. You missed the first half, which we apologize, but I'm sure you picked up where we were at.
Yeah, no, I'm sorry to miss this. I will listen to the recording. I think for the definitely for the parts that I missed. I think just want to just maybe a couple thoughts or comments. One is to just continue to thank all of you and your teams for the Herculean efforts and important work that you're doing. We would not there's just no scenario at all in which we would be where we are today, and having been able to stand up enough childcare in our state without the partnership and the hard work of all of you and your team. So, I'm not sure, Alyssa maybe mentioned we had the opportunity to brief the governor on a number of things today, including childcare in the state. And I think it was, the gratitude I think comes from her. She is just in awe that our state was able to so quickly, have a capacity. We have 22,000 by the numbers, and we wouldn't even have these numbers if it wasn't for the work that you're doing. There are 22,000 families using emergency childcare across the state of Oregon right now, and we were able to stand up a new process and a regulatory framework with lightning speed, and to be able to. So I just, that's just incredible. So thank you. Thank you for all that you're doing to support providers and families, keeping 211 up to date and viable with availability, being able to have that data to be able to look at these kinds of trends and fluctuations that we know have been happening and will continue to happen, to understand kind of supply and demand is just critical right now to guide a lot of the very difficult, I know, decisions that we've all had to make to date. And we'll continue to do as we get through this emergency and think about how to make sure that we have always enough childcare to meet the needs of children and families in our state. I will just note a couple things I was reflecting on last night. It was interesting to see the numbers just to the point about fluctuations. Last week, we were tracking at about 11,000 vacant slots in the state, and this week we're, like numbers as of yesterday, we're 9,200. That's a big shift in just a week's time, and so that I feel like is the new normal. It was reassuring to be able to tell the governor this morning that there's enough. Right now, there's enough emergency child care, but that we need to be focused on making that sustainable, that these are difficult conditions and a difficult financial model for these emergency child care providers to operate under. And I think that's where getting the resources through the CARES Act to help support emergency child care is going to be critical, and that it could change really quickly, and that we need to stay vigilant, as more of Oregon, I know as Alyssa's been talking to you about, reopens. We're going to be going into situations where, the landscape changes. Maybe more providers are full. Maybe in some parts of our state, we won't have enough care. And we're going to need to be able to respond really quickly. So I think that's, it's interesting kind of to think about. So we're just thinking about that, I think is important as we continue to do this work together. I think as well, thinking about for all of you, and I think in working with Joan and John and Margie and Lisa and the team, what is Cass and others, what is sustainable, as we think about reopening. I think this is the first of many conversations, one of which it sounds like centered today on, what are providers going to need. But I think we have to be talking about what does our infrastructure look like long term, and how do we begin? And I think you'll be all critical to that conversation. Like, how are we going to be in this for the long haul, right? To be able to monitor supply and demand, to be able to get resources to providers, to be able to get technical assistance to them around how to operate safe care in the middle of an emergency that, you know, isn't, as Alyssa said, we're not going to flip a switch, and there's not a magical date right now when we're going to go back to the old system, you know, and the longer that this goes on, how much is the old, that what we're doing now part of the new system that we're kind of trying to build, and what is, you know, what does sustainability look like, and what does the new infrastructure look like to support the kind of, you know, childcare that we know could be, you know, months and months and months, maybe even a year or so until we're through the worst of this pandemic. So I think that's a really important conversation to have. And then last thought is just, I've asked all of you, and I'm sure you're doing this, but I think we all need to be in sync and on the same message. Like, this is not the moment to go back to custodial care. This is the moment to talk more than ever about why we need quality, safe care, why the work that providers are doing is more complex and more difficult. You know, as we reopen Oregon, you know, I think there's, you know, one of the ways I feel like this could go sideways is to, you know, be able to have children in places, as opposed to, you know, continuing to talk about our values around quality, culturally responsive care, developmentally appropriate care, care that's safe. We have to talk about really what's needed. Children and families are going through a lot of stress. We need the right kinds of environments if they can't be with their families, you know, and cared for. They need to be in, you know, in high quality environments, and we all need to be kind of continuing to send that message of how important it is, and talking about, you know, this is really complex work to be able to provide this kind of care, implement these kinds of health and safety measures. And so we need to be leaning into more supports for our providers, building that infrastructure with all of you. And so please, you know, don't lose sight of, in all of the opportunities that you have to talk about what's happening with childcare, to send that message more than ever, that we are still committed to, that has not changed. We're still committed to quality childcare, affordable, accessible childcare. We need an equitable system. Like, we need those principles, and kind of to lean into our values more than ever. So anyway, those are random thoughts by me. Thank you for all that you're doing. I do hope that we can have kind of some of those kind of infrastructure conversations with all of you as sort of we go forward, and hope that you will help get that. I'm sure Alyssa talked about the survey, get the survey out, spread the word so we can hear from providers, and we can bring as many of their voices kind of into some of these conversations about reopening Oregon. So that's all. I'm sure we'll be talking more. Hang in there. Take care of yourself. Thanks.
Thanks, Miriam. Thank you very much. Alyssa, do you want to remind people of kind of what's going to happen next, and when they could anticipate hearing or seeing more, just to kind of wrap it up?
Absolutely. So you'll next hear, probably through Joan and her team, you'll get a link to the survey. Please feel free to send it out to childcare providers, any of your contacts, so that we can get as much input as possible directly from providers through this first iteration of guidance. As of right now, our goal is to have initial guidance drafted by Friday, and I'll be working with the health authority to make sure it doesn't just completely fly in the face of what public health thinks needs to go forward. My hope is that I can share that initial draft guidance with you all and our other partners that we're engaging next week, but I will let Joan know if that's getting pushed out further. Once we start to have some more contours to this, have some more details added, definitely want to sit back down with you all and get your thoughts and feedback. I'll share out sort of what we heard from childcare providers as well, and hopefully we can focus a little bit more on how CCRRs can support childcare providers in implementing that guidance moving forward. So hopefully more next week, and I will keep you all posted if that timeline starts to shift.
Thanks, Alyssa.
And Alyssa, you all covered the executive order timing and some of that. Actually, no. So we will be issuing an executive order today that will respond to extending the closure period for childcare. So similar to what we are doing with our other executive orders for restaurants and others, and with this reopening framework in mind, the closure extension is going to be until, read the language for you exactly. So it will remain in effect until terminated by the governor. And the governor will continue assessing the ongoing public health emergency and modify or rescind the executive order as appropriate. So what that means is we are not putting an official closure date or new closure date out for childcare providers. The closure is extending beyond April 28th. But because we're talking about this reopening framework, we're talking about regional reopenings on a rolling basis. We didn't want to mislead childcare providers, make them think they had to wait until a certain date when some providers may be asked to reopen before others. So that's the thinking behind the sort of open-ended nature of this executive order. I will make sure that Joan and you all are in the loop about messaging coming out of our office. I think as much as you can help us support the message that this sort of indefinite nature does not mean childcare is never reopening. It doesn't mean it's opening next week either. We're really just trying to be thoughtful and responsive to all those kind of gating criteria I walked you through quickly, and making sure that it's safe to start reopening childcare, and that reopening childcare is going to happen at different points in time across the state. So that is why we're making it sort of in this indefinite timeline. So I'll share sort of the messaging and talking points we have in our office, and would appreciate your support in helping providers kind of understand that thinking too, because I know it's really scary to not know when you can reopen again.
Thanks, Alyssa. We will also have some communications coming out from ELD, which of course you all will receive as well. So more to come on that later today, right? Are we still shooting today? Yes.
Yes,
okay.
today.
Today
is the day.
Yes.
Yeah.
Today is the day. All right. Well, thank you both.
Thanks, everyone.
Thanks, everybody.
Yeah. Take care.
Take care.
And so, with that, I think we'll move back into some of the other agenda items that we have here. But I want to pause for just a moment, as that was a very extensive and dense amount of material, and I just want to make sure that you guys have a moment to weigh in, debrief, ask or get any other questions kind of out there. I think that it's extremely important, some of the comments that I've seen here, like Nancy, sort of having a pulse on what's going on in your guys' communities. She was able to get an update from a hospital childcare program showing that in the last couple of weeks they had almost 200 extra hours of pay associated with providing the care in the current format that we're doing. And so I think those components are hugely important for us all to be aware of as we're moving forward. I think Karen's comment is similar when we're talking about having the needed supplies to reopen, and thermometers being potentially an essential thing that folks may need. And I do want to say that we do have a very limited supply of thermometers, and they're the no contact ones that you can either scan foreheads or use in the ear. But we do not have enough to go around to every program in the state. And I think it's important to understand that childcare providers are already supposed to have thermometers on site as part of their emergency kits and their first aid kits. And so, but if you are hearing that programs, and I would assume, larger programs that may have multiple rooms, and that they could use some of these more robust thermometers, we would take your recommendations on which programs may be needing those, but we want you to be sort of a gatekeeper for that. Licensing specialists are also keeping a pulse on that for us. We are ordering some more, but again, it's they're expensive. They're not cheap at all. But if there are programs that truly need them, we would love to hear from you on your recommendations around that. But so that was just an example that Karen was bringing up. I think we're talking about more than just thermometers, but needed supplies are hugely important. And then there was some comments from Toby around, what if programs can't open back up immediately? And I think that's where some of our other resources are going to come into play to help programs sort of kickstart and get things back into place.
John, I'd like.
Yeah, go ahead.
Joan, I'd like to talk about a couple of the comments in the box about the recording and the slides, and just say, like, I advocated for you all to have this opportunity as leaders. So I'm going to say again, this is information that you have received that is not for you to share. You are not to get ahead of the governor's office on sharing these slides and what you heard. This is to help you be able to understand where we're headed, and if you get questions, it's an orientation for you. And we want to have Alyssa and Miriam come back, and we want to have these serious conversations we need to have about infrastructure and things going forward. And part of that happening is all of us behaving responsibly with this information. I'm just being really frank with you about that. That includes texting people about the executive order or any of those things. The governor's office leads communications. We follow the governor's office, and this information was shared with you as leaders for your information only. So we will provide the slides if we're given them, but you are not to show them, duplicate them, reproduce them, any of that. And the same is true with that recording. It is only for you to listen to. And the times that we're in are so uncertain, and it's irresponsible for us to behave any other way. And we need to all be on the same page with that. We unfortunately had a data link that was provided, which was then being shared, that was never intended to be made public. And so it's just very fresh in my mind that all of us have to have this commitment as a part of our leadership for this work in this state. So thank you for listening, and please following that direction.
I just want to say I appreciate that also, Joan, because I think sometimes we get into the mode of so much information coming forward and wanting to be as forthcoming as possible with people who are asking questions, and it's easy for even us at the Early Learning Division to want to get out ahead of our skis. And so I think that reminder is critical and much appreciated. And I think each of us will benefit from just having this at our disposal as we are getting questions, because we know you guys will get questions as the media is released around this. So going back, let's see. So Jerry, you said you received these slides yesterday without the direction that you just received. Can you come off mute around where that came from, or?
So it came from a hub director, and yeah, I didn't say embargoed, or it had no like don't share. So I will say that I did share it with a few people. So I appreciate getting the guidance now that that's not supposed to happen, but I will say that yeah, it's out there. So.
And those are specifically the slides that Alyssa presented on? Okay.
Correct.
Okay. Mm-hmm. Good.
Thanks for letting us know, Jerry, and I appreciate people putting the pause button on further sharing. I'm going to let Alyssa know that, and if I get different direction, I will let you all know. But I think the danger we run into is that on very many slides, you saw there was red language that said, this might still change, this is draft. So we are not trying to build people's mindsets that this is the way. We are not ready to do that. And there was, I know you all understand that, so thank you for letting us know.
All right, so I'm going to share my screen again and get back to the slides and see if we have enough brain capacity to continue where we left off. So let's see here. Yeah, I think this is a little bit about where we were. So I think there was quite a few questions. Do we still have our DHS partners on the line?
This is Regina. I'm here. Jen had to step off for another meeting.
All right. Thanks, Regina. I'm going to just jump back here because I think that's what we were in the middle of. I'm going to look through those chats here and see if there was any other clarifications we might need. So I think you had answered Hannah's question in the chat box. Jessica had said, so to be clear, the document that Margie sent out on April 9th for April 13th changes is not accurate. And she said that it was titled the temporary childcare changes due to state of emergency as of 4/13/2020.
Yes, that's correct.
That's correct.
It is not accurate.
Okay. And
so go ahead and just shred them and get rid of them and not share.
Excellent. And let's see, Karen was saying, can these changes come out officially in writing? Is there any documentation on this coming out?
Yes, it's in the works. We're just waiting on a couple of decisions for May ongoing, and then we'll get it out to everyone.
All right. And then Christine was jumping back to further back in Jen's statement around the ERDC payments. And she said, when you say guidance is not different, does that mean that May looks the same as April? Providers, so that providers that are closed can still bill, providers can still bill for children that are absent without any attendance?
At this very moment, yes. That is subject to change. Leadership is still discussing these points, so I can't say for certain, but as far as we know, yes, May will look the same as March and April.
Okay.
And if it changes, we'll let you all know.
Excellent. Let's see. I think that might. I'm gonna just. I can't stand the chat box, by the way, folks. So if there's any questions that were unanswered related to ERDC, come off mute.
I was just going to throw it out there again that anything that we have for updates and things like that, it would be so great if TRA put them on their site so we could have a one go-to place.
All right, thanks for that, Heather. Appreciate it. All right, so on the other agenda items here, I think it sort of relates to all of this. You know, with the CARES Act resources and in light of Alyssa's presentation to us, I'm curious around the work that all of the CCRNRs and 211 and what you guys are hearing on the ground with childcare folks, and especially ones that have opened up emergency childcare. Do you have a sense for how many of our emergency childcare programs have signed up for that and then have actually had little or no attendance at all, or so no children are there, they're waiting for referrals, but they don't have any kids in care? Do you have a sense for how prevalent that is?
John, Toby.
Yeah, Toby.
Many of our providers have openings. They have maybe one or two children that they don't have all the kids, and they don't have all their children because most of their children are at home because the families are not essential. So we do have a lot of providers, especially in Umatilla Union and Morrow counties, that have a lot of openings. And then in Malheur, and they have a lot of openings. Baker, most of our providers, they're about 3/4 of the way full. There's a couple that all their families are essential, like the Department of Corrections, police officers, fire departments. They already have families, but we do have a lot of providers, like I said, that have like only 2 children. That's it.
Okay. Any
This is Green County. I know that a lot of our providers are losing families. You know, it's kind of been a slowdown, and they're not full for sure. Even our I guess what you would call the pop-ups, they're not full either. So I agree with that.
Yeah, we're hearing that a lot too, that people barely have enough kids to stay open, and that many of them are calling and saying, are you sure I'm in the database? I haven't gotten any referrals. We checked, they're in there. So generally, Wayne County, that's what's happening.
Okay.
So, hi, John, this is Linda. Interesting that you're hearing that, because we're hearing from families that they're being turned down for care, even though they are considered essential workers. I got 3 calls yesterday from families that said every provider says they can't have, they won't take us.
Interesting.
I'm sorry, who was just speaking?
Melinda, I'm sorry. Melinda with the
Hi. Hi, Melinda. We need specific information about those sites, because the emergency child care application requires people to attest that they will serve children of essential workers. So if they're not serving children of essential workers, we don't want them open.
Okay,
so
and that's kind of what, thank you for that, and I'll get that information.
Okay.
When I spoke with these 3 families, I said, we talked about advocating for themselves and that they are going back to work next week as essential workers because their time's up. And so I will get that information.
Yeah, so I think that's a broader message to all of you. If you hear that families are being turned away because of who their employer is and the work that they're doing, we want to know the specific information about those programs so that licensing, the Office of Child Care, can follow up. Because if people aren't willing to serve those folks, then they cannot be open as emergency child care providers.
This is Shannon. On the other side too, which is not right in its respect as well, but if there are children with special needs, providers may turn around and can't handle that type of child. And so it could be that part too. I'm not sure, but think about that.
That makes, yeah, I appreciate that added piece. But then we want to be working with those folks around those issues, right? Not just letting families, essential workers, be turned away. Like, our goal has to be every essential worker can find emergency child care so that they can work and take care of the rest of us. So we just want to understand.
I just wanted to put that other side to it as well. It could be.
I think that I'm seeing in the chat box comments about this, and what we've seen is some of our providers want to keep their 5 or 6 kids that qualify that they've already worked with and not open new slots for new families. Are they required to have 10 slots open? Because we have several providers that are like, we're full, but we know they only have 6 or 7. They just don't want to open up to additional new families, which seems like not the spirit of the thing.
Well, and that's what I've been wondering as well, because I feel like they're getting some mixed message, is that they need to keep kids in a cohort, but now we want to tell them that they have to take on new kids. So it's a mixed message, and I think that might be part of the issue.
So this is Carrie. Oh,
okay.
We've heard.
Go ahead, Carrie.
Sorry. We've also heard some comments from parents about that, and sometimes providers have said that I think they're confused and think maybe they have to hold those slots for medical staff sometimes too. And so if it's like a grocery store worker as opposed to a medical provider, they'll take on the medical provider's children first, or kind of confusion around that where parents have felt that that's what's happening. I don't know for sure if that is what's happening.
Yeah.
Go ahead.
Yeah, so this area, and we're hearing that providers who are caring for school-age children are really overwhelmed with taking care of the school part of they're taking on that teacher role, and so they've got kids and children of different ages that they have responsibilities for, so they don't feel like they can take another child even though they have slots that that there's just so much time that needs to be spent with the school part of what's needed to care for school age children.
Yeah, that's an important note, Jerry. I think typically with family child care programs and even our center-based programs, those school-age children were before and after school, and now they're all day. And so the dynamics of a mixed age group have now become significantly different over the period of an entire day. So important to bring that forward. And I think this is helpful for us also because I think if a program has in their mind already has some essential workers or emergency personnel's children in their program, they may believe that that's prioritizing and not necessarily are willing to take additional kids. So I think it might be good for us to think through this more specifically, but I think it's most beneficial for us as families are running into barriers to try and troubleshoot those specific situations and make sure that we don't have the perceived issue, which would be that truly they're just being turned away. We want to make sure that when we're able to provide referrals, that it's to tangible places in our communities.
Yeah. I think if people don't want to take referrals, they should set to no referral too, but I think John is correct. We want to understand if families are essentially being, I'm going to use a strong word, discriminated against because of their employment, which is one of the things that we started to hear. So, and if we need to issue more information, communication around what it means to be an emergency child care provider, which we may very well need to do now that we basically are in a longer period of operations under those rules. Like, I think that's what Miriam was kind of forecasting. We're not just having this like temporary OHA guidance. We may be operating under these ways of doing business for some time. What does that say about the training that needs to be provided so people are really able to implement the guidance? What does that say about professional development opportunities? Like, some of those things we are going to be wanting to talk about because we're not returning to operations as they were in February in any kind of near term. So I think this is just a part of that, of how do we continue to really support the folks that are providing emergency child care and making sure that those folks understand and really are following the guidelines in all ways, because they really need to be doing that even if they're still serving the same children they were serving before. They need to be doing the extra sanitation. They need to be, all those things need to be happening. So I think that's another thing that I don't know that we have time for it today, but we really need a beat on how much is that happening? Are people really doing the things that are in the OHA guidance? And what are the barriers they're experiencing to doing some of those things?
This is Shannon. I know I had several conversations with some of the providers, and they were talking about the tier levels of I'm only accepting the tier 1, and but I'm not getting the calls for the tier 1, and so we're sort of giving them that next step. Well, there's also the governor's essential workers for the grocery, whatever. Start opening up for that slowly, and If we had more of a communication, I think made it clear that they can accept those, because I think a lot of them are afraid to open up for that next level, and we were trying to help them through that. But
okay.
Yeah,
Thanks, Shannon.
I think that's an important, you know, and I think just the more clarity that we can provide around this, the better. But I think people in absence, or even in just interpretation of what's best for their business or their program, are getting to those places where they're like, yeah, I'm gonna care for you know, healthcare personnel, and then forgetting that there's, you know, they can't necessarily just prioritize one segment of what our prioritized populations are. But that's important to know. And I just wanted to note that there was just a few more comments around school age care, and I think Christine and Taya have confirmed that not only are we talking about it's an expanded day, it's an individualized curriculum for each kid, because if you've got a third grader and a fourth grader and a fifth grader, each teacher has a totally different set of things that those kids have to complete online. And I think the comment was made, it's hard enough to do this for our own kids. I can't imagine doing it for a whole group of kids in childcare. So that has probably changed the trajectory of what our childcare providers are trying to achieve so significantly. I only say that because I can't even do my one kid. Right after this webinar, it's distance learning time. So anyway, so let's see. Another thing in the chat box here, Carrie, are providers being told or encouraged to homeschool school-age children, or is it the parents' role when they're home? And I'm sure it depends somewhat. I don't know that providers are being encouraged to, but if the child's sort of daytime hours are spent in childcare, they're probably more ready to do those activities than if it were in the evening. So I think it may fall towards providers, and I'm sure parents are excited about that. But anyway.
Well, one thing I have kids doing this too. Yes, it's really, really hard. And also my kids have certain times of the day that they actually have to be in class on the computer. So I'm sure providers, and that's could be different per school, even not just the district. So anyway.
Very true. Yep. All very important considerations. Let's see. I see Heather. Providers feel like they want to support the parent by helping them complete assignments, so the parents don't have to do that after a long work day. That's what they hear. And
Sorry, John. Or they're either hearing that, or their parents are directly telling them that they want them to support them for it. So, I mean, I've heard it compassion, and I've heard it, they told me so.
Okay. All right.
And we just did a curbside drop off with our providers. And so it was nice to be able to talk to them in person and get some of that kind of feedback regarding that, because some were absolutely stressed about it and some were just trying to plug through because they want to support their parents.
Yeah. Okay. Well,
Thank you. It's just helpful to hear how the providers are kind of handling it, because parents will, they'll ask us sometimes, and we keep saying it's kind of a case by case basis. Talk to your provider about what they can do.
Yeah, that is helpful. I'm going to move us forward here. We've got about 15 minutes left, and I think a few other subjects. Hold on just a second. Going to move past Alyssa's presentation. I can't believe that she made it through all of those slides. That was amazing. I thought this was never going to happen, but she was quick. Oh, shoot. Sorry, folks. Let's start over. I want to redo this presentation. I didn't do it right. We're going to start from the beginning. Just kidding. Okay. There we are. So, in thinking about some of the things that we wanted to make sure that we were addressing, the directors had a few questions that were forwarded to us by Shannon, and I don't know if Tammy was able to stay on. I think she probably had to leave. There was a question around, how are our health and safety requirements potentially going to change long term? Will there be new rules, new things like that? And I think that Alyssa and Miriam have mentioned there's going to be an operation. There will be operational changes for a significant period of time, and it could result in other things, but they're just beginning those conversations on the licensing and rule making side. Nothing tangible to state at this point. And I think there was a couple of questions around preschool promise. Dana, are you still on the line?
Yes, I am here.
Excellent. Do you want to just dive in, or did you want me to preface it in any way?
No, let's go ahead and just dive in. So just a moment here. Let me go ahead and transition here back to the meeting. I don't even know how to follow the different topics that have been shared this morning. But pretty much preschool promise. We're up and running. RFAs are coming in. Yesterday, we're monitoring like the activity that we get through our, MSA platform. And from what I'm hearing from our grants department is yesterday was a really busy day. People are going in there, filling out applications. Our number of applications in progress has increased. Last week, we were at 279. As of this morning, we were at 301. So that means that people are actually coming in and filling new applications. The message that we've sent through our communications department is it's not too late to apply, because it's technically not late to apply. The application is not due until May 4th. And then the number of submitted applications is increasing. So so thank you to all of you for sharing this, across your communities and for helping providers. We have, let me take a look here. Sorry, I got distracted with the chat box. It says, can we go ahead and share how many applications by county? We had that information last year, and right now it's like we are all like super busy. Everybody's requiring data. So right now we didn't have the chance to go ahead and get it by county. I only have the number of in progress and the number of applications that were submitted. That's increasing. And definitely, as you continue working with providers, send them to our RFA helpline. We have a staff available during the day that's taking calls. We have our email that's been closely monitored. And then we have our FAQ. In conversations with John, there's been some questions that have come up for RFA as you provide TA. I think one of them was, what happens if they're not able to go ahead and meet the salary guidelines, right? Which that's going to happen, especially with a mixed delivery. We know that with some of our in-homes, some of our certified families, based on the number of slots that they're asking, they're probably not going to be able to meet the salary guidelines, right? Just because they may be asking for like 4 slots or 6 slots and so on. So let me go ahead and bring it out. So what they will need to go ahead and do is they can go ahead and submit an exception for the salary. They'll just need to go ahead and explain the situation, and we know that the number of slots is probably going to cause them not to be able to meet the salary guidelines. Another question that has come up is the minimum requirements for a lead teacher. The minimum requirements for preschool promise for our preschool promise rules is a step 8 or a CDA. That's the minimum educational requirements to be a lead teacher in preschool promise. I've had the chance to go ahead and talk to some small businesses to say, but I'm a 7.5 and I am almost there. Can I still apply? I go back to our rules. It says that the minimum requirements is a step A. Some of them are really close, so I actually put it on them. I mean, if it's just one class that they're needing, I mean, I think the goal is by the time that the program starts, they're at step A, right? So I kind of leave it up to their business decision. I mean, there is not going to be a waiver that is that lower minimum educational requirements there. They do have the option. So I've directed them, go ahead and contact Oral, see how many classes do you need to go ahead and get to a step A, or contact your CCRR for more assistance on that. They could go ahead and hire someone with a step A. So, I mean, they can still apply. They just wouldn't be like the lead teacher in the preschool promise classroom. So there is a way for them to continue applying for preschool promise. So that has been one that has been coming up. Another thing that has been coming up is health insurance. Do I have to offer health insurance to our staff? We defer to the state of Oregon for employer, regulations on that. I am not an expert, and I don't work for DCBS or the state of, Secretary of State. But it does say that, less than 50 employees, you're not required to provide health insurance. More than 50, you do. But like I said, do not quote Dana. Go ahead and direct your providers to DCBS. I'm actually going to go ahead and share you a very quick link. It's with the Department of Consumer and Business Services. It's a nice little tool for applicants to go ahead and use, and it answers like, do I have to offer health insurance or not? And it takes them through this process. So I'm sharing that in the chat box because that's a great resource that you can give to applicants without you putting yourself in a situation where you're providing that guidance to them. Because technically, preschool promise, we don't require health insurance. What we're saying to our business owners is follow whatever state guidelines you're supposed to follow when it comes to benefits and stuff. Should they want to provide insurance? That's up to them. If they want to provide health insurance for employee satisfaction and so on, they can do that. So we've addressed those questions in our Q&A. Our Q&A is pretty big. It's like an 18-page document. Just so you know, whenever someone calls me, I open that document, I do a control find and put in a keyword in there. And then that's where you can go ahead and, take a look at some of those answers and stuff, or you can direct them to me. But to us, like I said, we have several people now taking care of that RFA line. But right now, we're trying to get everybody to that finish line. And it's actually really exciting to see that there's more new applications coming in. And like I said, there's just are in progress. So thank you for all that you're doing. Not sure if there's, I wanted to make it short and sweet because you guys have received a lot of information this morning. So is there any questions?
Thanks.
We have? Nope, we're ready. Sounds good.
Appreciate it.
Thank you, Don.
And let's see. So really quickly zipping through some of these last few agenda items. Mary Wolf is jumping right to the chase. Any word on quarterly reports? Do them and get them to me tomorrow, Mary. No, we are still working on what those might end up looking like. We have been having some dialogue with Sandy and Lisa and Margie and Joan and I around what we might do to sort of amend those or combine them. So more to come on that. We don't have the specific for you at the moment. I don't know if Sandy or Lisa wants to chime in any capacity. And that is apparently a silent no. So I think Joan had to sign off, or maybe she is still on. Nope, she's off. Appreciated having her on board today. But so quarterly reports, that definitely will be able to give you some more information as to what we're doing. We heard loud and clear, though, from you guys that some leeway about what we definitely need to have for our purposes, and sort of sidelining some of the other stuff we heard that from you guys. So we will do our best to address that. And then just
Yeah, John.
Yeah, go ahead, Lisa.
This is Lisa. I'll just jump in real fast. I do have to get on another call here, but did want to just say we definitely did hear you and appreciate you letting us know. And we are working closely with Sandy, and we're just trying to figure out the specifics, and appreciated the suggestion that you guys shared as what you think would be a good idea. And we're on board with that. We just need to make sure that we can do something like that and still kind of be in compliance with everything related to contracts. So we're working closely with Sandy, and more to come hopefully later this week. Thanks.
Thanks, Lisa. And then I think one of the other questions, which is probably a sort of let's wait and see how reopening Oregon rolls out. I think there was a lot of questions around summer programs, trying to enroll children now. People who, whether that's school age programs or even programs that sort of ramp up in the summertime. I think there's a lot more to come around that as we move forward. So I think after they hear the governor's order, they'll have more questions, and then we'll continue to figure out how we can support programs as we're moving forward. I did want to mention the TA logs, the focused child care network TA logs. You might remember that somewhere around March 31st, we were going to have a quick little orientation to the TA logs so that your staff knew what was expected. And then all COVID broke loose, and we delayed that. And I think the best case scenario here is you'll probably hear more about this in early May, where we'll start scheduling a very short overview. I mean, these things are not complex in order to help people understand how to utilize the TA log, but we'll give some overviews of that in May with an expectation that they have a soft entry into utilizing it and probably requiring it in June. There's some information that we're trying to capture in there now around all of this sort of emergency order and what kind of TA they're providing around, COVID response and otherwise. So I think we're just trying to amend it a little bit based on what current activities your staff are doing. Your staff will not need to be backdating any of their TA that they've given over the last several months. We'll just start from where we decide to take off at, but we want them to start utilizing it so they can work out any bugs with us if there are any. But that'll start here in May. So hope that makes sense. And is there a question?
This is Shannon.
Hey, Shannon.
Since my staff are scattered to the wind, working at home, you guys are still doing the QIS one-on-ones, right?
One-on-ones
with my QIS's network QIS.
So what has been occurring is some one-on-one activities or one-on a couple activities with Lead Learn Excel folks. So they've been scheduling monthly interactions with your QISs. But as far as one-on-ones, like between for instance, the infant toddler specialist network, any of your infant toddler specialists have not had specific one-on-ones with. Well,
they were meeting with Sydney earlier on, those kind of things. They're not happening right now.
Not right now, no.
Just wanted to make sure.
We've been talking to your staff all along without you, and it's been great. So good luck figuring out.
John, this is Lisa, and I'm not sure if this is what Shannon was referring to, but we are still holding the communities of practice. We have been doing that for the most part. We've kind of been leaving it up to the groups to decide if they want to participate. And for the most part, those have still been happening.
Got you. Okay. Thank you for.
Yeah, that's not a one-on-one though. Those are the group sessions. It's been a little bit more about what are they seeing and hearing out there in the field, and how can we support them. So not anything too intensive. I think there's been a little bit of content from Lisa's perspective on, you know, the network. I mean the community of practice that they recently held, and the infant toddler community of practice is going to occur next week on Monday, and again is just really trying to get a pulse on what they're currently working on, where they're seeing barriers, and trying to ensure that we can help with that.
So I've not been great at monitoring whether staff are attending or not. You guys will let me know if that's the case or not.
Yeah, it's been pretty good attendance, and so if we were thinking that there was issues, we would get in contact with you. But they've been appreciating the opportunity to connect with each other. I think is probably the biggest part of what we've heard in their feedback, is just hearing what other QISs are doing and going through, and not feeling like they're sort of dangling out there alone.
Wonderful.
So
thank you.
We are just about at time. Are there any other things that you know, we did not get a chance to kind of debrief? Today was a really extensive bit of conversation, and a lot of information to sort of download and comprehend. So we'll probably continue to talk about this on our next call. And obviously, after the governor's order is amended today, I'm sure that will come with some additional guidance and information. Any last thoughts?
John, this is Christine. I guess my only last thought is, the second that these orders come out and things are announced, I am flooded with partner questions and calls. And I'm just having a hard time. While I understand the ambiguity of the governor's response and actually think it's pretty decent, that's not really easy for a lot of people. And so any kind of talking points that can come out would be really, really helpful.
Okay. Yeah, I appreciate that, and we will do our best to get additional talking points out. And I just was informed that the meeting that Joan needs to lead next cannot start until we get off of this meeting. Apparently, this is her channel that we are organized under. So apologies for sort of an abrupt end. Feel free to email me if you have any questions, and otherwise, it's been great hearing from you guys today, and thank you very much, and we'll talk to you more soon.